How does extrapulmonary TB present in children? Have you ever wondered how extrapulmonary tuberculosis presents in children? Extrapulmonary tuberculosis occurs when the bacteria Mycobacterium tuberculosis infects parts of the body outside the lungs. This is different from pulmonary tuberculosis, which mainly affects the lungs and shows respiratory symptoms. In children, extrapulmonary TB can affect various organs, leading to different signs and symptoms based on where the infection occurs. One of the most common forms of extrapulmonary TB in children is lymphadenitis. This usually involves the cervical lymph nodes, causing them to swell. The swelling is often painless at first, but if untreated, the lymph nodes can become fluctuant or even form abscesses. Another serious form is tuberculous meningitis. This affects the membranes covering the brain and spinal cord. Symptoms can include a persistent headache, fever, vomiting, irritability, and lethargy. Neurological signs such as neck stiffness or issues with cranial nerves can also occur. Tuberculous meningitis requires immediate medical attention. Skeletal tuberculosis is another possibility where bones and joints are affected. This can lead to localized pain, swelling, and reduced movement. Commonly involved areas include the spine, known as Pott's disease, as well as long bones and joints. Abdominal tuberculosis can impact the peritoneum, lymph nodes, or gastrointestinal tract. It may present with abdominal pain, distension, fever, weight loss, and in some cases, bowel obstruction. Miliary tuberculosis is a more widespread form where numerous small lesions develop throughout various organs. This can cause systemic symptoms like prolonged fever, weight loss, failure to thrive, and generalized swelling of lymph nodes. Extrapulmonary TB can also affect other areas such as the genitourinary system and skin, each presenting with specific localized symptoms. Children with this condition often show nonspecific signs like prolonged fever, weight loss, night sweats, and general malaise, making it hard to diagnose. The absence of respiratory symptoms and the variety of clinical presentations mean that healthcare providers need to be particularly vigilant, especially in children who have been exposed to tuberculosis or are immunocompromised. Diagnosis usually involves a thorough clinical evaluation and imaging studies tailored to the suspected site, such as ultrasound or magnetic resonance imaging. Microbiological tests, including molecular assays, and sometimes biopsies of affected tissues are also used. Early detection and treatment are crucial to prevent complications and improve outcomes. In summary, extrapulmonary tuberculosis in children can present in many ways depending on the affected organ. Recognizing these varied presentations is key for timely diagnosis and effective management. Always consult healthcare professionals for personalized medical advice.